Hi, it's Nena Clark-Christoff, one of the nurses, Cynthia Gregg, MD, face and body specialist. You're going to be with me with a pre-recorded Ultherapy presentation, but at the end we'll go live and I'll answer your questions. So certainly if you have any, if you'll feel free to start typing them in now. So we'll get started, and my question to you is, are you looking for a collagen boost? And I think most of us are. You can see here when we're young, we have all these beautiful collagen fibers, the elastin, all the hyaluronic acid that helps to cushion our skin. And as we naturally start to age, we start to have a decrease in all of this matrix. What determines how fast this process occurs can be lots of sun exposure, your lifestyle, as far as if you're a healthy eater, smoking, stress is certainly a big factor, and time. Again, it's just a natural process of aging. And so when we're young, we have this beautiful heart-shaped face, lots of volume here, no wrinkles, a beautiful jawline. And as we go along the aging continuum, we start to see problems with some of the wrinkles, the brow going down, we lose some facial volume, our jawline becomes more jowly, and we start to have more issues with our neck. And so with Ultherapy, how it works is for your body to naturally build its own collagen. You can see here we start to get the wrinkles, we lose some of the fibromuscular layer, and this becomes less firm and supporting. This is a picture of the actual transducer that we use when we're delivering those energy lines with Ultherapy. Typically, we do our post photos instead of 3 months, around 6 months. That's when we found to get your final best result to compare before and after photos. And hopefully at that point, you should be able to see this improvement, the thickening of your skin, and in the tissue down here, that fibromuscular layer. So why would you choose Ultherapy? It really is the gold standard for lifting and tightening. We've been doing it in our office about 8 years. We have a lot of experience with it. Both myself, Melissa, and Andrea Crane, we're all CAN certified, and we've done a lot of Ultherapies for quite some time now. And why it's so good is we're really able to customize it and plan with you, really targeting the treatment areas. And about 95% of the people say that they have great results and are happy with it. For anybody who is late in joining us, please do know that if you want to type in questions, I will go live at the end to answer those for you. And so this is a screen of the machine that you can actually see as we're treating you. We work in different treatment zones. The first thing we do when we get you in is we put marks on your face to identify these treatment zones. And then we put some ultrasound gel on your face. We put on different transducers that treat at different depths up here. And we really start to look underneath your skin and to see what we're finding so that we're able to customize and treat your skin. We really want to pinpoint these rich collagen layers, and I'll show you that on the next slide. But I think the key here is really in the customization and having somebody with a lot of expertise. So right on this person, you can see that they have collagen pretty much everywhere. These people are really easy to treat. Up through here, this person's is much higher. We would not be treating them down at these deep layers or be treating into the muscle where you don't make collagen. And so people often are asking me, so how does Ultherapy work, Nena? So, well, it's different than these other things. When Dr. Gregg does a facelift, she's really moving the muscle. She's the gold standard. You're not going to get a surgical outcome with Ultherapy, but you can get nice improvement. And oftentimes it might be Ultherapy would be a good choice for somebody maybe in their 40s, early 50s. It's not ready for surgery yet. For people that don't want to ever have a surgical procedure, or perhaps for people that had a facelift with Dr. Gregg 5-10 years ago, and now they're just wanting something to freshen up their look. Lasers, we're working much higher. This is more like ironing the skin. You're helping with wrinkles, texture, tone, pigment, but you're not going to go down deep to stimulate these deeper collagen layers. Radio frequency, we don't do in our office. You're really just putting out heat and hoping it goes to where you want it to be, but you might be inadvertently getting rid of some of the fat, and fat is our friend. We never want to do that. With Ultherapy, therapy, again, we're treating you at least 2 layers. Sometimes we're doing 3, 4, 5 different transducers to accomplish our predetermined goals. But you can see how we're putting down these little thermal coagulation points, little heat spots that your body makes collagen from. And so with Ultherapy, there's really very little downtime. You might be red for a day or maybe an hour or so, really. Super safe safety profile, really customizable, and nice natural looking results, I think, are pretty consistent. You can see with these people where you really get that improvement. It's along that jawline, it gets more chiseled. You can see improvement in that submental fat area and a nice kind of lifting, upward lifting of the cheek. And I think that's pretty consistent in all these people that you can see that improvement, particularly with this person. We also inject Kybella, a product that helps to break up that submental fat. So sometimes we'll combine modalities. Oftentimes we'll go in on Ultherapy and we'll add some cheek volume to help give some of that lift if we've lost volume. And so really the whole treatment experience is what I think we're really good here at Dr. Greg's office. We do put marks of different zones that will be treating you. We have a consultation prior so that we're very clear the day you come in. We've got our treatment goals. We know how we're going to customize for you. We've signed the consents. We've got our baseline photos. The first thing we do once we get those marks on your face is we look on that screen and we make sure we can really read your skin and we know what zones we're going to be treating you. The whole treatment takes about an hour and a half. And as far as comfort, it's not the most comfortable procedure we do, but we're pretty good at handling it due to all of our experience. Some clients just use a Motrin, some like an anti-anxiety medicine that we can provide. And some people, we use the Pronox. You may have heard it as laughing gas. It's nitrous oxide that a lot of dentists use. But that's something we've been doing for over a year now. We've had great results with that. And I think the key is really in the follow-up. We really want to make sure that we've met your goals, and some people like to do it again, maybe every year, every 2 years, so that your results just keep getting better and better. So now we're going to go live, and I'm going to try to answer any questions for you. If you will click on the logo in the top right-hand corner of your screen and join the playlist, I'll meet you there. Thank you.